good day po, sir. So, I will be your student nurse for today. So, may I know your name po?
I'm Mohammad Amjad.
So, what we're going to do is to assess your nose and your sinuses. So, the first one is the nose. So, let's start. Okay, so the nose is symmetrical and straight, same color as the face, no lesions or swelling, no nasal flaring or discharge. So, sabihin nyo lang po kung may maramdaman kayong pain.
No.
Okay, so it is firm, non-tender, and no masses at all. Okay, so paki-close po yung mouth and then paki-close po yung one side ng nostril nyo po. And then breathe po kayo sa open na nostril nyo. Sa other side naman po. Okay, so the air flows freely through each nostrils. So next po. Detail po yung head niya. Okay, so the mucosa is pink and it is moist, no swelling and no lesions at all. And the nasal septum is at midline and it is intact. Sir, pakisabi lang po kung may maramdaman po kayong pain. So there is no tenderness and no masses at all. And next. So there is light above your eyebrow. So paki-open po sir yung mouth niyo. So there is red light inside your mouth. So good day po sir. So I will be your student nurse for today. So what's your name po?
I'm Mohammad Amjad.
So what we're going to do is to assess your mouth and oropharynx. So let's start. Paki-first ko yung lips nyo. So, your lips is pinkish. It is smooth, moist, and no lesions at all. So, it is symmetrical. It is moist and smooth. No bleeding and no lesions. So, paki-open po yung mouth. So, if you have any dentures po, pwede po pakikuha muna. So, wala na. Open your mouth. So, your teeth and gums are clean. White teeth, no bleeding, and it is pinkish. Open. So the roof of the mouth, which is the hard palate, is pale and it is firm, while the smooth palate is pinkish and while the soft palate is pinkish and it is smooth. Okay, protrude yung tongue ninyo. So, the color of your tongue is pinkish and it is moist, and the top of the tongue is slightly rough, while the underneath is smooth, and there is no any sign of lesions or masses or swelling. So, paki-touch yung tip ng tongue nyo sa roof of the mouth. Open your mouth. So, the floor of the mouth is pinkish. It is moist. Also, there are frenulum, and there's no signs of swelling. So, paki-move yung tongue ninyo upward. How about downward? And then side to side. Okay, so your tongue moves freely. Open your mouth as wide as you. Protrude your tongue. So there is no masses and there is no presence of masses and lesions. Open your mouth. So your tonsil is pinkish and it is small and near to absent. So your tonsil is symmetrical and no swelling. So say ah. Repeat.
R.
Okay, so the ovula, it rises with phonation. So the posterior pharyngeal wall is pinkish, moist, and no lesions. So the client reacts with a gag reflex.